Histex PD is a medication that contains triprolidine, an antihistamine that helps relieve symptoms of allergies, hay fever, and the common cold. These symptoms can include rash, watery eyes, itchy eyes/nose/throat/skin, cough, runny nose, and sneezing. This medication works by blocking the natural substance histamine, which is produced by your body during an allergic reaction. It also blocks another natural substance called acetylcholine, which helps to dry up body fluids, relieving symptoms like watery eyes and runny nose. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. So, don't use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, like long-acting tablets/capsules, are not recommended for use in children younger than 12 years. Remember, these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Don't use this product to make a child sleepy, and don't give other cough and cold medications that might contain the same or similar ingredients. Always ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. And make sure to follow the recommended daily dosage and take the medication at the optimal time for best results. When taking Histex PD, it's important to follow your doctor's instructions. Usually, it's taken every 6 hours, with no more than 4 doses in a 24-hour period. You can take it with or without food, and if it upsets your stomach, you can take it with food or milk. If you're using the liquid form, make sure to measure the dose carefully with a special measuring device/spoon. Don't use a regular spoon because you might not get the right dose. If you're taking the chewable tablets, chew each one well and then swallow. The dosage depends on your age, medical condition, and how you respond to the treatment. It's important not to take more than directed, and to take it at the same times each day to get the most benefit. If your symptoms don't improve after 7 days, or if they get worse, develop a fever or chills, or you think something serious is going on, get medical help right away. Some common side effects of Histex PD include drowsiness, dizziness, headache, nausea, vomiting, loss of appetite, constipation, stomach upset, blurred vision, decreased coordination, and dry mouth/nose/throat. These effects may decrease as your body gets used to the medication. If any of these effects persist or worsen, contact your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. If you experience dry mouth, you can relieve it by sucking on sugarless, hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to drink plenty of fluids unless otherwise directed by your doctor to prevent the thickening of mucus in your lungs. If your doctor has prescribed this medication, it's because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, including mental/mood changes, ringing in the ears, trouble urinating, easy bruising/bleeding, fast/irregular heartbeat, or seizures. A very serious allergic reaction to this drug is rare, but seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. Remember to consult your doctor for medical advice about side effects and to report any side effects to the appropriate health authority. Before taking Histex PD, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions or other issues. Be sure to also inform your doctor or pharmacist about your medical history, especially if you have breathing problems, eye problems, heart problems, high blood pressure, liver disease, seizures, stomach problems, overactive thyroid, or urination problems. Histex PD may cause dizziness, drowsiness, or blurred vision. Using alcohol or marijuana can increase these effects, so it's important to avoid them while taking this medication. Be cautious when driving or operating machinery, and consult your doctor if you are using marijuana. If you have diabetes, liver disease, phenylketonuria, or any other condition that requires you to limit sugar, aspartame, or alcohol, be sure to talk to your doctor or pharmacist before using Histex PD. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Histex PD, especially dizziness, drowsiness, confusion, and low blood pressure. Children may also be more sensitive to the side effects, and in young children, this medication may cause agitation or excitement instead of drowsiness. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. This medication also passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid using Histex PD with antihistamines applied to the skin, as this could lead to increased side effects. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Always check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Additionally, Histex PD may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. As always, it's important to discuss any concerns or questions with your healthcare provider. If you or someone else has taken too much Histex PD and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, contact a poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Symptoms of an overdose may include dilated pupils, flushing, fever, hallucinations, weakness, tremors, muscle twitching, loss of consciousness, and seizures. In children, excitement may occur initially, followed by coordination issues, drowsiness, loss of consciousness, and seizures. Make sure to keep all your scheduled medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of these appointments to ensure you are getting the most benefit from Histex PD. If you forget to take a dose of Histex PD, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. It's important to store Histex PD at room temperature, away from light and moisture, and not in the bathroom or freezer. Make sure to keep all medications out of reach of children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.